a lot of organizations in healthcare, and it's not just medical tourism organizations, misunderstand what marketing is. They tend to think that it's the advertising, the promotion, the communication, maybe trade shows that get people in the front door. Now, once they get them in the front door, they forget that these patients become patients. They can run out a back door. Now, if they go out the back door and they're happy, they're going to tell everybody else they know, gee, I had a great experience, I've come out of this really well. But the patient, if they're unhappy, the patients will come out and they're going to tell everybody they know how bad their experience was. They're going to go to every website that they can think of and start posting, especially in healthcare, because that has more of an emotional impact on people than just a bad washing machine. And they'll tell physicians, the patients will tell their physicians, they'll tell anybody they can in the medical system, all their friends, their whole social network, that they should avoid not only that company, but maybe all of medical tourism. So it's important to pay attention to not just marketing at the front door, but marketing at the back door.
Patient retention.
Patient retention to keep them in the house. There's all sorts of reasons that patients are going to be upset, and when they go out that back door, they're going to do you a disservice. And it could be anything from poor medical care, poor surgical care, poor infection control, to bad communication between the medical tourism agency and the patient. Maybe they were supposed to be picked up to be brought back to the airport at the end, and the pickup never happened. They missed their plane. Now they worry about who's going to have to pay the extra amount for the plane. And if they have to, they're going to be sure the whole world knows about it because they didn't make a mistake, you did. So what is it that a medical tourism agency can do to keep their patients happy so that, in fact, those patients go out and say wonderful things about them and say, hey, you know, you really ought to get that surgery done, or you really ought to go and get the surrogacy arrangement done in this country by this agency? One of the things you do is you actually address the complaints of your current patients, because if you can identify what those complaints are, if you can analyze the source of complaints so you know what's causing people to complain, then you can fix those problems, which stops people from complaining and makes happy patients as opposed to unhappy patients. The problem with companies of all types, not just medical tourism agencies, is no one likes to study unhappy customers. They don't like to hear complaints. Sometimes they listen to it with the phone away from their ear. Sometimes they get written complaints, they throw them in the wastebasket, as opposed to saying, wow, this is a complaint. Let's get on it, let's fix it so that the customer, the patient, is happy. There's not ever going to be a problem figuring out what the problems are from the patients if you just have an open ear, because if they have a problem, they're going to call you. The problem that we see in a lot of organizations that don't do this well is once they hear a complaint from a patient, they don't respond, or they don't respond adequately, or they even try to tell the patient it's their fault when it's not, because they know that fixing it's going to cost money, but it costs more money ultimately to the company if in fact the patient goes home and complains to everybody, because that's more patients who you will never get. All the places that they post and now you have potential patients reading, those patients will not come to you. And instead, at the front door, you're going to have to spend much more money on advertising, promotion, communication, and so forth than you would have spent just fixing the problem to begin with. The research that has been done on this isn't specific just to the healthcare industry. It was done initially by Gary Loveman, who is the CEO of Harrah's, one of the major and most profitable casino chains. And he took that and applied it to Harrah's, which is what made them so much more profitable than they had been before he came. What he and two other academics showed was that a 5% increase in customer retention or in customer referrals, because if you don't think they're going to come back, they do refer other patients. So a 5% increase in patient or customer referrals brings on a 25% increase in profits. The practices that everyone needs to engage in, whether it's medical tourism agencies or any other industry, include, number one, collecting the information when people complain, clustering those and being able to identify the sources of complaints, responding to them. It means that you have to have a culture within your company where you hire people who actually are prone to want to solve problems, where you train them that is part of their job, and you train them how to solve problems, where you put the resources in their hands to actually solve the problems. Merely telling them, try to solve their problem, but don't spend any money, that's not going to work. You actually have to put resources in their hands. And then you have to monitor your employees to be sure that they are doing what they're supposed to be doing. Southwest Airlines, as an example, tells their employees that whatever it takes, try to solve the customer's problem within reason. They had an example of someone who probably spent too much money, more than they had expected, to solve the problem of a passenger who had missed a very important flight. And rather than fire the employee who spent too much, they actually made announcements throughout the airline, look how far he went to solve the customer's problem. It's probably too much money, but he did the right thing. They retrained him, and they gave him a promotion. That tells everybody else in the organization that, in fact, their job is to solve the customer's problem. What it takes is a culture of problem solving and recognizing that even if the customer might be slightly wrong, that either you educate them truly as to why they're wrong, but be sure you're right that they're wrong and that you're not the one who's wrong. And that secondly, if it's a minor perception problem, that it's still worth it to solve the problem because the customer believes their own perceptions. And if they walk out that back door thinking you screwed them, they're going to turn around and screw you.